Hello everyone and welcome back. My name is Philippos and I'm the lead for Health Careers Live Europe, one of our latest global ventures aiming to bring together key health workers and thought leaders from across the European continent to share learnings and build partnerships that aspire to a stronger, more diverse and more integrated European healthcare workforce. This will be a rather different session than the ones you've had today and you will attend later today. And I'm very pleased to be joined, to be actually inaugurating the Health Careers Live Europe with a truly inspiring panel of speakers here to talk about their lived experiences of displacement due to conflict in their home countries. A situation unfortunately still faced by many healthcare workers around the globe. The conflict in Ukraine has shaken people all around the world, but it has most importantly impacted those who used to live in a once peaceful country. Today we'll hear from these people, health heroes that have felt the impact of war in their personal and professional lives. We will listen to their stories, their perspectives and their hopes for building back better, stories which might echo the issues that are faced by healthcare workers facing conflict all around the world. So without further ado, I'll let our wonderful speakers introduce themselves before we move on to discuss some of these key issues. For our viewers, feel free to post any questions that you have in the Q&A section, and we'll try and go through them while we have this discussion. So please join me in welcoming our fantastic panel of speakers. Over to you guys. Nastya, would you like to start with your introduction? Please go ahead.
Yes, do you hear me right?
Yes, we can hear you.
Yeah, all right. Okay, so I'm a third-year medical student of Lviv National Medical University, and I do study in Lviv. This is the western part of Ukraine. Currently, I'm local coordinator of the Ukrainian part of the project in the Ukrainian part of the PFMSA, International Federation of Medical Student Associations. And this is my pleasure to be here. Thank you for this amazing opportunity to share my experience, because throughout the last few months, like in the half of the year, I've been traveling a lot and I have plenty of things to share. So I'm happy to be here. Thank you.
And Oksana, would you like to go next?
Yes, hello. My name is Oksana from Lviv. I am an associate professor of pediatrics department number 2, Danilo Halitsky Lviv National Medical University. At the same time, I am pediatric allergist in Lviv City Children's Hospital, and I am familiar with the problem which has happened in our country, and I can compare how it changed the life of our students, our patients, and our people. So thank you also for this great opportunity to be a part of today's great conference, to speak one another. And with a pleasure, I will share my experience and my everyday practice.
The pleasure is ours to have you guys on the panel today. And lastly, Lolita, would you like to introduce yourself?
Yeah, hello everyone. It's nice to be here with you. I'm Lolita Matiashova, and I was a PhD student in National Institute of Therapy in Kharkiv, and now I changed my PhD to Basel. It's in Switzerland, but first 10 days of the war I was in Kharkiv, and we organized a huge help for our patients and for our people, and so Kharkiv from the first day facing troubles like with the war and still, and doctors, my colleague who is still there, some facing. So I really grateful to have this opportunity to share some stories with you.
Well, it's wonderful to meet you all, and honestly, thank you for being part of this panel. The pleasure is ours. and the opportunity to have you on this panel today to talk to us about some of these experiences, share some reflections, tell us how that has impacted both your professional and personal lives. It's an opportunity that we here at the Health Careers Live team really value. So thank you for being with us today. So to start with, to set the scene, you've already mentioned some things about how this current situation has impacted you, and you cannot understate the consequences of war in general: death, destruction, displacement, loss of community, just a few of the consequences. And on a more personal level, war can have devastating effects on people's lives, and it would be great to hear what your journey has been like, how the war has impacted you in your clinical practice, in your studies, and how has it impacted you personally. I think our viewers would really like to hear these reflections from you. So whoever wants to go first, please feel free to do so. Nastya, I can see you're having some thoughts you'd like to share. Please feel free.
Okay, thank you so much. All right, so I'm just the youngest here, and probably I do not have so much of experience. I'm still learning, but I do have something that I want to share. So since the beginning of the war, our lives have changed significantly because we couldn't focus on those things that we were focused on, like on self-development or self-improvement, only to study for ourselves and to do all of that. I think that all of us learned to focus more on the society and to help as much as we can, especially as all of us are in the field of medicine. And so did I, even though I was mentally affected, and like nobody knew what to do, because like who expects the war to come to your country? Like never. But when it happens, all you have before is like it's never the same. And I think that personally I have learned how to be stronger and how to do great things. For example, our family decided to escape from the war, and we fled to Israel, and we were there for some time, and I just couldn't focus on my studies. I couldn't do that. I wanted to do something for my country, and that's how I found other students, and we made a collaboration from students of Tel Aviv Medical University and organized the charity event that raised more than $5,000. And I'm not sure if there was no war that I would ever be able to do that, because it gave me strength and belief that I want to do something. And I did that, and that's what I keep doing. So I think that's personally, I was like really morally traumatized, but not that physically as people from the eastern part. But still, I learned a lot. So yeah, that's what I face.
That's very inspirational to hear, and I think for someone who hasn't gone through such a situation, I think it takes a lot of reflection to be able to empathize with what you have gone through and how this has impacted you, and some very strong messages that, you know, determination can come out of very difficult situations, and this is certainly what it seems that you have shown through the things you've done. So thank you for that. Would anybody else would like to chip in on some thoughts? We've already sort of touched upon how this has impacted your colleagues, how this has impacted the way you delivered practice, and you know, feel free to sort of pick up from that.
Yeah, I can continue. Mm-hmm. I will start. Like, I want to share experience about like the first 10 days, because Kharkiv, it was like one of the first who faced it. And like everyone in Ukraine, all of us woke up at like 5 a.m. on these days. And I remember before the day we left from the work, we had a lot of patients in the hospital. Some doctors were stayed for the shift and so on. And like everyone like went home. And then when everything started, we face that we can't go to the hospital because in Kharkiv, the main public transport is subway. And from the first time, from the 5 a.m., the subway stopped and it started to be like a shelling. So it was difficult to move in and so on. So as a result, doctors couldn't go to the work. Doctors who were in hospital and who weren't prepared to stay like 3-4 days in the hospital, they stuck there. The patients who needed help, they couldn't go to the hospital. So it said to be a huge problem, and we saw it. And my institution started like initiative in Kharkiv. We collected our all phone numbers and we put it like in our social media, in our Kharkiv regional site, for that people can't call us and like for consultation and so on, because we haven't like a choice. We couldn't like go even to like polyclinics or somewhere. And everyone for us started receiving calls. So at least somehow we couldn't help people. We also, I received personally calls from Kyiv, also from Bucha, from Irpin, when it was like still connection. And sometimes it was like woman, like I remember this call like from a woman, like she called me like from Irpin and said like, I have like 1 month year baby, and now I think like I have like tonsillitis or something. I have like a huge temperature because always like all time was spending in their basement. So and it's like I have like some antibiotics. I'm not sure, and it's like by phone, like it's like you can't like even call her like with video because the connection really bad. So it was like a lot of problems which we faced and which we somehow could like possibly to like figure out and so on. And like I think from this point we learn a lot, and somehow like people said to help each other and like find new way. And also for me personally, I like with my friends around the world, we started to write in articles, like we started like to make this story bigger. So, and I'm really glad and grateful that it's still continue, because we still suffering a lot of problems and we still need help and need to continue to telling our stories. And it's like good that now today we're all here to continue this journey. Thank you.
And it's certainly a great pleasure and a great privilege to be able to hear these stories and to be here to echo these messages and to tell the stories of how you've been able to adapt to a very harsh reality, how you've been able to make the best out of a situation, to keep your commitment to your patients and deliver the care that has to be delivered. The health needs haven't stopped being there, they've actually increased, and this is something that we sort of move on to discuss later. But before we do that, I'd like to hear some final reflections from our latest panelist, Oksana, if you'd like to add anything to that.
Yes, first of all, I want to tell you that by 24th of February, we lived in a peaceful country, and we couldn't even imagine that war can be present in 21st century. Yes, we have read this information that war can be possible, but anybody couldn't believe in this situation. And when I woke up in the morning and when I got this information from TV that it's really now the war become reality, first it was a shock information, and we couldn't know what we have to do. How can we stay in our country? It was we analyzed, is it safety for our children, for our family? And at this moment, I think that we start to help one another to support. And for example, I am living in the western part in Ukraine, and at this moment it was, and now it's more safety region than another cities in Ukraine. And we try to help. So we were not on this active zone of the war, and we try to help another regions. First of all, I'm like a teacher. I had my working day to study students, foreign students at the university, and they call me in the morning that they move they are looking for possibility to leave our country, and some of them moved to Kiev and they were blocked there, and others moved to Polish. And I received a lot of calls from my foreign students. They were in a panic. They asked me about information. For example, what shelters are present in Kiev, and I was looking in internet, and we share this information to save them. So it was a very, very difficult time for them, and we organized a chat with our teachers at the university, and we share this information to support our foreign colleagues. And practically during first 2 days, they leave our country. Another problem which was present in Lviv and in our western part, that many people move from another eastern part and central part of Ukraine who plan to move from Ukraine. And I saw how many mothers and their children were waiting on the border to leave our country, and some of them were waiting for 4 days. And some friends, which I know, some of my friends, were waiting there without any meal. They don't plan to stay so long time, and their 2, 4, 3 years old children were at the car without any drinks or food. And I want to say that people who live near the border of Poland, they help very much. They prepare hot dishes for them. I know many people who were volunteers at this time, and they bring snacks for these children. They bring clothes for them. And I think that at this time, it was difficult for everyone. It was different. It was difficult in different positions. But we accumulate our forces. We help one another, and many people abroad also support Ukraine. And after this first or 2 days of shock, we got a big help from another countries, and it helped us to understand that we will have opportunity to help one another, and other people support, and all civilian work support our country. As a doctor, I also had many complicated cases with patients who couldn't stay in our country because at this moment it was dangerous to stay. When we have an alarm ring, we have to move to the shelter, and it was very difficult with our patients who have severe disorders. We try to give our consultation online for patients who have mild or moderate causes of the disease, but who really need surgery or who really need another more complicated disorder and who need to be followed up by doctor. They stay in the hospital. And at this moment, we receive many help from volunteers from another countries because we double our equipment. For example, in intensive care department, we have equipment for acute pulmonary ventilation, for CPAP, another type of oxygen therapy, incubator for newborn baby. And we, in first 10 days, we double all equipment in our shelter. And in our country, the hospital in Lviv, we had many patients. Some of them moved from another part of Ukraine to stay here, but some of them stay like transit and move to another countries. So it was really difficult situation. But at this situation, we become more strong. We are sure, we believe that in this war, we win because we didn't plan any situation. We don't want anything from Russia, for example. We only want to save our country, to save our people, and to live in an independent country.
Some very powerful words from you, and I think what you said in the beginning, that you never thought that this would ever come to your country. I think this is probably the situation for a lot of people who have faced conflict in their lives, and it's certainly something that the people who had been following the news that morning, where they read the headline, most of them couldn't believe it. So I think most people won't forget the day that they heard that this is happening. And I sort of echo the thought around how such a situation, despite how devastating, despite how difficult it is, how destructive it has been, it's been met with a response that's brought people together, that's made people work together to deliver amazing things, some of the things that you've mentioned yourselves, and it's inspiring the way we can support healthcare workers that are displaced in the future. And that's actually something that I want to sort of move on from and stay on that thought and ask you what you've felt has been the support that healthcare workers fleeing countries such as Ukraine have received across Europe, across the UK. The NHS here has, for example, granted free access to healthcare for all of those who've come from Ukraine, seeing it as a moral imperative really to support those displaced. And we can talk more generally about how do we support healthcare workers that are displaced due to conflict, because this is not something we've seen for the first time. It's something that's come to our doorsteps and has really reminded us that conflict is all around us. This is happening en masse everywhere, but now it's reminding us that we need to do something about it, and we need to support countries like Ukraine. So feel free to share any thoughts on how we can best support displaced workers.
All right, so okay, I can start.
Go ahead, please.
Okay. I just saw that. I just saw that Oksana's microphone is on. Okay. So what I wanted to share is, again, from the student's perspective, I think, because I'm still, like, even though I mentioned that I couldn't focus on my studying so much because of the war. Now we still want to be doctors, and we want to become great professionals, and we want to get the best knowledge that is possible to get. And with the current situation, it has become really hard. So now it becomes better, but still at that point, it was my fourth semester. So second year, fourth semester, it was terrible, I would say. So what I was looking for, and I know a lot of students were looking for, some programs, scholarships, then some resources. And we're so grateful that UK medical schools have posted a lot of materials online, like explanation, lectures, all of that was accessible, and we're grateful for that. But still talking about I know that the question was about displaced workers, but what about displaced students? I know a lot of them who are struggling to enter the medical system in UK, even though there is a lot of support, but still lack of knowledge and completely different systems. It makes it really, really hard to even understand what are those systems like A levels or whatever that's. There is some information about it on the internet, but if there were some generalized structures or some particular people who could help students, for example, to assist them with all the questions they have, that would be really, really helpful for them. And I think this way it would be easier, at least for our students to get, for example, their scholarship and to go there to see how it is going on, to learn something and to go back. Because like me being a medical student, and I know a lot of other students who are like going from one country to the other country, and then they get the best knowledge that is possible and come back and then do something for their country. And that's what we're trying to do. And when other countries help us, as the UK countries, when they do support us and help us with that, it makes our so-called mission easier. So yeah, that's what I wanted to say. Thank you.
I think from what I take from this as a key learning point is that there's been stuff that's been done to support students like yourself, and I can imagine what it must have been like having to travel around, not really having a place, having to do everything online. I believe you're still studying online, which in itself, a medical course it's challenging to do it online, not to be there with patients, not to be practicing those skills that you need in your day-to-day work. We do need to do more to support transitions. We do need to do more to inform people as to how we can potentially sort of standardize the way we teach our medical students in medical school, because I understand that this has been the challenge across different educational systems that have used different standards and don't really communicate. So it's a very, very important point you raise, and thank you for that. Do any of the doctors in our group like to share how they felt, what opportunities they felt they had once the conflict broke out, and how they felt they were met in Europe and across the world?
Yeah, if I may, I will continue. So yeah, first, like, let's say what was done, and like actually a lot of things was done. So at first, all Ukrainian people, they receive free medical care in all Europe, which was like a huge help. Then immediately after like few days when the war started, all Europe started to announce different scholarship, different like observation opportunities to research for doctors, for different specialty. And in Wien, in Germany, you can like found easily for at least 4 months observation for doctors. And I can say also about Switzerland, what they did. They announced for 1 year scholarship, like scholar at risk. And for doctors, for scientists, and especially me, I apply for a science program because since in Kharkiv we have also problem with electricity because of the shelling. My blood samplings from my PhD, it was totally destroyed, and I can't continue, and like I can't collect a new one. So I wrote to professor, I wrote for this scholarship, I got my position, and I could continue work. Then I had possibility to apply also for a PhD. So also I know another doctors from Ukraine, who now at first they starting take like observership in Switzerland, and now they started to work, and like till now Switzerland continue to support Ukrainian doctors, Ukrainian scientists in medical field, and medical student. They can go for 1 year visiting program and have scholarship and like have degree. So like it was a lot of help. And especially for me, which like could be done more, like if more country would like announce this 1 year program, because when I was looking, when it's like 4 months, it's more difficult because you don't know what will be next, and like 4 months, it's not the stability which you're looking for. And also, we found a lot of doctors from Europe. They said to be open for online consultation and for consultation with doctors. And if we can continue this, when Ukrainian doctors, can call like with like telemedicine with video and like ask help, it will be really, really good. I think from my perspective.
It's certainly very, very nice to hear that your experience has been a very positive one in terms of the response and the way that you felt supported from people in other European countries, the fact that you've been able to continue what you were doing and continue and start your PhD in Switzerland. That's fantastic. But as you say, there's still room to do more, and I think some of the things you talked to us about today have really sort of echoed what still needs to be done, and it's honestly a pleasure to be hearing these things right from the source from you guys. Any final reflections from Oksana on the topic before we move on?
Yes. Thank you. So from my experience, the war gave us a lot of challenges, but at the same time, with the support of another people, we receive many possibilities. And I also want to classify these possibilities for example, for students. They have support in countries who are our neighbors. For example, at the university in Lviv, which is more safety region from another parts of Ukraine, about 25% of foreign students move from our university to Poland, to Slovakia, and these countries give a chance for the students to proceed with their study. So they didn't start like on the first course, they proceed their study in another universities. For our students, for Ukrainian students who are in Ukraine, we have a lot of materials for free from another European countries. We have a platform, different scientific platform, where we can share information from different nosologists, from different subjects, and it's a great support for us to study, to develop our knowledge, and to go in one way with another students who study medicine in another countries. When we are speaking about patients, many patients with oncohematologist with another chronic disorders move to specialistic centers in other countries, and we help with translation of their history cases. For example, I was working with grants from Germany and from France and from Poland. And I received information. I was like coordinator between patients and between people who are ready to take different patients with different nosologists for treatment. And we coordinate these patients. For example, many patients with severe neurological problems moved to Germany. They received their surgery there and rehabilitation. A lot of patients with oncohematologists moved to Polish clinic. And we really appreciate for this possibility to help these people, because they cannot receive this treatment in our country now because of lack of electricity, because of lack of drugs, and because of dangerous situation. Another what I want to tell you is that we receive a great support with drugs for our partners, for example, from different associations. First days of the war, we received a lot of humanitarian help, which is in direct action on the front line. It was different hemostatic, it was different surgical equipment which was transported on the front line at this moment. Then we start, it was the drugs come to our country, but there was like mixed different groups, antibiotics, inhalations, surgical, and some drugs were in lack, another were, for example, another drugs were too much. We start to share these drugs with another doctors from another clinic. And then we start to work with associations. For example, we had doctors who are cardiologists, and they spread their experience, they declare what they need for first line in treatment, and they receive these specific drugs or specific equipment from specialists of the same line. I, like a pediatrician and allergist, I receive a lot of help from our Italian partners and from France. And we share, we can give these drugs for our patients and for refugees who move from another countries. We can give it when it was absent at pharmacy, or we can give it for free. And it's a great support at this moment for our patients. So summarizing, I want to say that we accumulate our force in different directions, and it was not only our general job. So I started to do a lot of work which I was not familiar before, which was not my basic work, but we couldn't be passive, and I was surprised when I received a lot of calls from my friends, from my relatives, from my even not my friends, but friends of my friends that they want to help, these people who were known for me before come to the clinic. They help to prepare shelters, they help with different drugs, they help with to help people move from another region from one region to another. At this very difficult situation, we received a huge help from one another and from another people abroad. It's my experience at this moment.
I think your reflections really show that apart from just supporting displaced workers, supporting the people who are in the front lines or delivering the care, we're also talking about supporting healthcare systems in ways that are meaningful, with devices, with medicines, with meeting the needs that arise from such a situation. And it's truly inspiring to hear just what a massive response, what a massive mobilization, how we've brought together people of all different nationalities, not only Ukrainians, but people from Europe, people from all over the world wanting to chip in and help. I think there are a lot of learnings that we should take from this and generalize to how we deal with anyone who who deals with such a horrible situation, who deals with conflict in their own home country. So having talked about all of this and having reflected a lot on some of the things you've said, I'd sort of want to end on a different note and ask you, despite all the difficulties that you face, despite all the problems that the situation has created, what opportunities do you see for yourself in the future? What opportunities do you see for the healthcare workforce as a whole? And what message would you send to anyone who is facing such a similar situation of conflict and is trying to get through their clinical training, is trying to get through their medical school, is trying to get into healthcare and start their training? Because as an organization, this is what we've been founded on, this is what we've mostly sort of occupied ourselves with, and it's a real privilege to extend that to something much more meaningful, much more powerful with having you on board here today. So I'd like to hear some final thoughts from you on these points.
All right, so I think that my main message would be to be brave, and the words that you mentioned today was determination, and I would rather emphasize on this word, because you need to believe in yourselves and that you can do whatever is important to you. You can meet other people, you can explain them what you want to do, and you can do it all together, and it works, because this is how this world works. And this is the most significant thing that I've understood throughout these months, that we're able to do whatever we want if we believe in that, and if we can make other people believe in that. But the first thing is like to believe in yourself, right? So you can prepare for that exam, you can get that scholarship, you can enter that medical school, you can organize a charity event, you can do whatever you want. It only depends on you. So this is my message. So no external circumstances, no wars, no conflicts. Even if everything is bad, you can always find positive things about it. You can always learn something and keep working on yourself. So yeah, that's what I wanted to say.
Anyone else, please feel free to share some reflections.
Yeah, if you like, I will continue. So for me, as you know, like the last 5 years, Ukraine trying to rebuild a medical system. And now I think we have a great opportunity when a lot of specialists in Europe, some in USA and so on. So every one of us can learn something the best from every system and came back and rebuilt it and made it perfect, not perfect, but really good, So, and my message for everyone who struggles the same, what we going through, what we went, I'm just want to say you keep going, no matter what, keep going, and you're not alone. Here are a lot of people who is ready to be with you, near you, support you, and always give your shoulder, their shoulder to help you. So just keep going, and yeah, everything will be okay.
I think I have to sort of repeat that message. You're not alone. I think that's a very inspirational quote to have in the back of our minds, and it's truly sort of phenomenal to hear this from people like you who faced challenges that most of us have never even imagined would have to go through. So, Oksana, if you'd like to share a couple of thoughts for a minute or so before we close off, that would be great.
I'm sorry, I had bad connection. Can you repeat your question?
So we're just talking about reflections on
yes, about reflections.
what opportunities do you see for yourself in the future, and what would you say to someone who's going through a similar tough situation, is facing conflict in their home country and is trying to go through clinical training, is trying to get into medical school, is trying to finish their medical studies, clearly aligned with our mission at Health Careers Live?
So my message at this situation is that we have to do the best on our working place. So everyone has to do everything which he can do at this moment, and at this place, at this country. Many people move now to another countries and stay there for the moment when we have this active war. But they can help distance. They organize different volunteers help. They help with money, financial support. We understand that when you are alone, you cannot get any result. So our force is to be together one with another and with another countries. And I think that in this situation, everyone can find and everyone changed his life. We will never be the same like we were before. That is why in this situation we have we are dreaming. Our dream is the one for everyone now. That is why we have to do the best, and I really believe that together we will win, and I hope that it will be in soon future.
I honestly am very glad that we've finished on a very, very positive note, and the energy that you've given out and the reflections that you've shared have really echoed that. It speaks to the strength, the commitment, the determination that we mentioned before, that you have shown, that a lot of people who have faced such difficult situations end up having to just come up with it. You know, it's never something you can really prepare for. It's just when you're put on the spot, that's when you have to respond to a situation in the best possible way. And from everything I've heard from you today, it seems that you've done incredibly well in that respect. And it was really a pleasure to hear your stories and to hear your reflections. And I'm sure that our viewers would probably have had a lot of thoughts. They might have had some reflections. I understand that some of these topics might be difficult for some people, and I would like to invite them to share some reflections that they have, to write some thoughts that were generated from this discussion. Please feel free to do so at the chat. We would love to hear what you've thought. And thank you again for the panelists. You've been amazing. It was a real pleasure to have you here. I hope you enjoyed it, and have a good rest of your day.